Hello, my name is Shirley McGaffin. I am a Cardiovascular Nurse Specialist with the Our Hearts, Our Minds team. I qualified in 1990 and I have specialised in cardiology since 1992, joining cardiac rehabilitation in 2007. I am also a registered nurse prescriber. Stopping smoking can seem really daunting. It can seem quite impossible. But actually, with the right support, it is something you can achieve. We have helped many people to stop smoking. We have a great team of healthcare professionals to provide help and support. You can use this video to start your journey. A partner or other family member may even join you on it. You are 4 times more likely to quit with the help and support of a healthcare professional. It is a good decision to stop smoking, and you will have had strong advice from your cardiologist to do so. Remember, quitting smoking is the single most effective thing you can do to avoid further heart problems. What do you think a cigarette contains? For instance, tar is composed of thousands of poisonous chemicals. It lines the bronchial tubes and lungs and is carcinogenic. This is why you are giving up. Smoking damages the lining of your arteries, leading to a build-up of fatty material, atheroma, which narrows the artery. This can cause angina, a heart attack, or a stroke. Carbon monoxide in tobacco smoke reduces the amount of oxygen in your blood. This means your heart has to pump harder to supply the body with the oxygen it needs. The health benefits of stopping smoking. Within 20 minutes, your blood pressure will drop back to normal. Within a year, your risk of having a heart attack will have dropped by half. Why is it so hard to stop? Why is nicotine so addictive? Once in your brain, nicotine leads to a release of dopamine, which makes you feel good. If you go for a couple of hours without having another cigarette, you start to experience withdrawal symptoms. This feeling of discomfort makes it difficult for you to resist having another cigarette. When you inhale cigarette smoke, it goes to your brain in seconds. You can have periods of strong urges to smoke, poor concentration, wakening at night, irritability, restlessness, anxiety, and low mood. The acute physical withdrawals do not last much more than 4 weeks, but after 4 weeks it feels more comfortable. During your first assessment, we will discuss the options available to determine which best suits your situation. This enables us to find out a bit more about your triggers so that you can understand what makes you want to smoke. We will look at the medications that are available to try so that you can find a combination that is suitable for you. We will measure your carbon monoxide level, which is a great indicator of how your body is recovering as you stop smoking. There is no one-size-fits-all to stopping smoking, so it is important to have a strategy. A useful tool is making a list of your main motivators for quitting, whether for your health, family, or financial reasons. Reading the list when a craving occurs will strengthen your resolve. Another tip is to share with family and friends to engage support. Maybe one of them wants to quit too. Partners and family need to support you for this to work, perhaps helping to get the home ready, remove ashtrays, and asking other members of the family who smoke to do so outside. Plan ahead on how you can manage your triggers. You might consider altering your daily habits. If you normally have a cigarette with your coffee in the morning, why not swap to tea instead? When you have a craving or urge to smoke, try to do something else instead. Go for a walk, phone a friend, read a book or magazine, have a healthy snack, or just wait for 3 minutes and think again. It is worth considering, especially at the start of your quit attempt, to avoid alcohol as it weakens your resolve. Finding a new hobby can be a useful distraction to divert your thought process. As part of the Our Hearts, Our Minds program, you will be encouraged to exercise, as this not only improves mental and physical health, but also provides a useful distraction when stopping smoking. Some people can be concerned about putting on weight when stopping smoking. The average weight gain is about half a stone or 4 kilos over a year. Weight gain varies, but gaining weight is less risky to your health than continuing to smoke. During the program, you will receive dietary support and physical activity advice to help mitigate any potential weight gain. The dietitian will be available to suggest healthy alternatives. Smoking is an addiction, and so it will be a difficult habit to kick. Medications are good, and we are here to support you, but medicines are not a magic bullet. You still have to be motivated to quit. They are designed to help reduce withdrawal symptoms, but work best in combination with counselling and support. Medications is offered in the context of overall holistic support from the Our Hearts, Our Minds team. Varenicline, or its trade name Champix, is a non-nicotine treatment and is probably the most effective way to stop smoking. It takes the enjoyment or hit out of cigarette smoking, reducing the positive reinforcements of smoking. It can be used in combination with short-acting nicotine replacement products. The course usually lasts for 12 weeks, but can be extended if necessary. The nicotine replacement therapy substitutes nicotine to reduce withdrawal symptoms. The best way to use nicotine replacement therapy is to combine the long-acting patch with the short-acting gum, inhalator or nasal spray. Nicotine is the addictive ingredient in tobacco. It is the least harmful component. Nicotine can help you quit and does not cause cancer. The cigarette causes cancer. The main difference between cigarettes and e-cigarettes is that there is no combustion. They are popular with smokers and can help you quit smoking for good. Please do not feel overwhelmed. Think about one thing at a time. You will see a dedicated nurse throughout your care and get the right support you need. We are here to help and support you throughout this journey. Thank you.